right. Well, good morning. Thank you all for joining us today. It's a big day here on Capitol Hill. As you all know, earlier this morning, Leader Jeffries' bipartisan discharge petition to force a vote on a clean 3-year extension of the Enhanced Affordable Care Act tax credits reached 218 signatures. The fuse has been lit, so to speak, and the Speaker must call a vote on this proposal today. We now know with certainty that the votes are there to ultimately ensure that these tax credits under the Affordable Care Act for working families across the United States don't expire before year's end. Speaker Johnson has a very simple choice to make. Does he send home the Republican Congress for the holidays and let these tax credits expire? Or does he do the right thing now that House Democrats and 4 of his own members have signed a discharge petition compelling a vote that would otherwise not ripen until early January? I and my colleagues here will continue to make the case that the Speaker ought to do the latter. He ought to call that vote today. Let the chips fall where they may, and let us work together to ultimately secure health care for millions of Americans. With that, I want to yield to my distinguished colleagues here who have joined us, each of whom are really professionals in every sense of the word, many of whom have served as physicians and understand the real stakes when it comes to this particular debate around the Affordable Care Act. And there is no one, in my view, who understands those stakes more clearly than my colleague, the distinguished gentlewoman from Illinois, a former nurse, Congresswoman Lauren Underwood, who serves as one of the co-chairs of the Democratic Policy and Communications Committee.
Thank you. Well, good morning, and thank you so much, Representative Neguse. Thank you all for joining us today. Today is one of my favorite days in Congress because today's a healthcare day. I'm so pleased to be able to be with you in such a critical moment. As you all know, I'm a registered nurse, and I'm joined by colleagues who, like myself, have made healthcare our life's work. We are just 15 days away from the expiration of life-changing, life-saving healthcare tax credits that have put affordable healthcare within reach for record-breaking numbers of American families. This healthcare crisis was created by this Republican majority through their own cruelty and neglect. In communities all over the country, working families are learning that their healthcare costs will rise to completely unaffordable levels. These are families who will be forced to make a choice between their mortgage payment or a doctor's visit, between taking a second or third job, or spending more time at home with their kids. People will be sicker. They will not be able to see their providers. Families will be forced into bankruptcy, and our already strained healthcare system is about to be stretched even further. We are staring down a complete disaster, and I need everyone to understand that this is a choice. These incredibly popular tax credits come from my legislation, the Healthcare Affordability Act, and for months we have been calling on Republicans to make these savings permanent. But they chose to ignore the issue. They decided to ignore the pleas of our communities and working families around the country. And still, all year at every turn, we have offered solutions and a path forward for ending the crisis that they created. We fought ferociously to save health care for the American people. But we have some good news because we now have the signatures to force a vote on my bill to extend these tax credits for 3 years. This majority has waited far too long to address this issue, and some damage has already been done, right? Open enrollment has now ended. That deadline was on the 15th. But there's no reason to add to the uncertainty and the anxiety that the American people are facing. The Speaker of the House, Mike Johnson, has an opportunity to do the right thing today and call the vote. And certainly he should not be sending the Congress home without an opportunity to vote to extend these health care tax credits. We know the votes are there. It's just a matter of time. But why put the American people through more chaos, more uncertainty, more anxiety, more cruelty? Let's do it now. So I am really delighted to introduce my colleague, a great physician from California, Representative Raul Ruiz.
Thank you, Assistant Leader Joe Neguse, for calling us together. I am extremely honored to be standing here in front of some amazing healthcare professionals. As you all know, Nurse Lauren Underwood is also a public health expert, and standing with Doctors Maxine Dexter and Doctors Kelly Morrison makes my heart jump with delight. I welcome them in their first term, and they're exceptional physicians who care so much about their patients that they're here in Congress fighting tooth and nail for their better health. Republicans created a healthcare crisis with the big ugly law. They cut nearly $1 trillion in Medicaid. They cut over $600 billion of aid to hospitals, long-term care facilities, community clinics. And then they cut food support for the most at-risk individuals in our country. This not only increases costs to those that are going to be cut from their Medicaid, but it increases costs for everybody. Because now you have 15 million people who are going to go uninsured and are going to be uncompensated care in your local emergency departments. These are 15 million people that are going to go without health care, and their preventative care, their chronic illnesses will get worse and will get more costly, and you're going to see a lot more comorbidities, a lot more pain and suffering in the American people. And now, on top of all of that, they fabricated an additional affordability crisis by actually refusing to extend the ACA enhanced premium tax credits. These tax credits make health care more affordable for millions of individuals and families across the country. But because of Republicans' deep-set grudge against the ACA, these tax credits are going away. But Republicans are actively choosing to put politics over people. Millions of Americans will soon be paying, in many cases, double what they used to for health care coverage or more. That's $18,000 a year for an individual on average that's 60 years old in my district. And after months of asking the Republicans to extend the affordable tax credits before they expire on December 31st deadline, they introduced a bill with 15 days left, a bill that will make healthcare costs more and worsen the healthcare affordability crisis. It's been 15 years since the ACA was passed, and they waited 15 days before the tax credits expire to introduce this bill. And this is the very best they could come up with? A bill that will leave millions without insurance and cause premiums to more than double for many Americans? Republicans have had 15 years to come up with another plan, explore ideas to make healthcare even more accessible and affordable for Americans, and their solution is to take away healthcare from more people and raise costs even more? This is ridiculous. Their solution is to create loopholes to circumvent the ACA's essential health benefits. Their solution is to push more consumers into these junk plans that don't cover essential health benefits. Their solution is to crack a backdoor abortion ban and strip women of the autonomy to make their own health care decisions, to allow these junk plans to discriminate against people with chronic health conditions. Are you kidding me? Their so-called Lower Health Care Premiums for All Americans Act, which should be named the Making Healthcare More Costly and Worse Act, like its name, is nothing but thinly veiled deception. Just another example of Republicans trying to pull one over the American people, the people they swore an oath to serve. Now, we have a very immediate now solution that will put this to rest and give us time to work on lowering costs even further and to increase access to health care. And that solution was answered by 4 Republicans who signed the discharge petition to extend the Affordable Care Act for 3 years. It is now solely up to Speaker Mike Johnson, who has the decision and the authority to bring this bill up for a vote now and today, so that people don't have to pinch pennies before Christmas, so people don't have to go through the stress and anxiety during the holidays, so people don't have to suffer even more when they see their sticker shock with skyrocketing prices of their premiums. Today is the time for Speaker Johnson to bring this up for a vote. We have the amount of votes to pass this bill. Without a vote, the fault lies clearly on the shoulders of Speaker Johnson, who refuses to help lower costs for the American people, and instead, in order to benefit his billionaire buddies, wants to increase costs and take away the important protections that the Affordable Care Act has given the American people for so many years. And with that, I want to invite Representative Dr. Maxine Dexter up to the podium.
Thank you so much, and what an honor to be here, and thank you to our Assistant Leader for bringing us together on this really critical day. Good morning. I am Maxine Dexter, Congresswoman from Oregon's 3rd. I'm very honored to serve that district, and I bring with me my perspective as a mother and a physician. And I did not come after 20 years of saving lives in the ICU to Congress to turn my back on the American people. I came here to fight for affordable coverage for every American. It needs to be accessible health care. That has to be our #1 goal. As a party, as a country, Americans are struggling right now just to make ends meet. It is our job today to make it possible for them to afford their health care. Mike Johnson, as has been said, must immediately hold a vote on the clean extension of the ACA enhanced premium tax credits. His moderate members are understanding what's at stake. The American people need relief, and they can get it from Congress if we take a vote before we go home this week. Not tomorrow, not next month, today. 4 Republicans joined Democrats to force a vote on the clean ACA extension tax credits, or extension of the ACA tax credits. And 4 Republicans recognized the simple truth that if Congress fails to extend the ACA tax credits, families across this country will be forced to make impossible decisions, whether to fill their prescription or fill the gas tank, whether to pay their mortgage or pay their premium. We cannot put our families in persistent affordability crises that we can prevent. This is something we can do today, and we must. Speaker Johnson should bring this bill immediately for a vote, and the life and health care of our constituents depends on it. Thank you very much. At this point, I get the honor to introduce Representative Dr. Kelly Morrison for her statement.
Good morning. Honored to be here with our Assistant Leader and these esteemed healthcare professionals. I'm Dr. Kelly Morrison. I have the privilege of representing Minnesota's 3rd District, and I am the first and only pro-choice OBGYN to ever serve in Congress. In just 2 weeks, tens of millions of Americans will be forced to pay health insurance premiums that have skyrocketed or get priced out of health insurance and lose coverage entirely. And what is Republican leadership doing in our final 3 days of session? Using the precious little time we have left to kick even more Americans off their coverage and block the bipartisan effort to extend tax credits so that working families can afford health insurance, and shove through a backdoor abortion ban. As an OBGYN, I want to call out this latest attempt at a national abortion ban and include it in the Republicans' health care plan that we're voting on today. Their plan would force private insurance companies to drop abortion coverage. This means even more women, even women who live in states that where abortion health care is protected, would lose access to care. That they would double down on banning access to life-saving care at a time when we are already seeing the consequences of the abortion bans that have been enacted since the court overturned Roe versus Wade is particularly unconscionable. Abortion bans literally put people's lives in danger. I am so tired of having this conversation. It is not a joke. We are talking about people's lives. Abortion bans increase maternal and infant morbidity and mortality. So this morning, I'm thinking about my patients and people across the country who, under the Republicans' proposed health care plan, would have less access to care, less affordable care, and more dangerous restrictions on women's health care. And on top of that, will suffer from Republican leadership refusing their access to any health care. Speaker Johnson, as my colleagues have said, could bring the bipartisan clean extension of the tax credits to the floor today, and I urge him to do so. Thank you.
Again, thank you all for being here. Pretty clear cut. The Speaker should call a vote. He should do it today, and we can save health care for millions of Americans. And I am grateful to my colleagues for really being the tip of the spear with respect to not just this particular issue, but more broadly, making health care more affordable for Americans across the country. I will just say in closing, one of the ways in which I think the Democratic caucus is so unique is that the mosaic of our caucus has such depth and breadth of talent. And you see that with respect to the medical professionals standing here today, Dr. Ruiz, Dr. Morrison, Dr. Dexter, and Nurse Underwood. Of course, all, as I said, preeminent healthcare professionals who serve their patients for decades and now are serving those same patients and a broader constituency in a meaningful way here in Washington, D.C. Questions? Yes.
Congressman, even if this bill passes in the House, do you see any realistic path forward in the Senate? We saw them already reject an extension of subsidies.
I think my short answer would be yes. I have no doubt that if and when this bill passes the House, Ms. Underwood's bill, which I believe will pass, that it will pass in the Senate as well. And the reason for that, I suppose, bold claim is fairly straightforward. Past is prologue around here. For 2 months, Republican members of Congress said that the 3-year extension of the ACA tax credits was a non-starter. They bemoaned it. They condemned it. They said that this is something that wasn't palatable to their conference. And we now are going to have an opportunity to vote on it. So, yes, while I understand there are Republican senators who voted against this 4 weeks ago, 5 weeks ago, or I said 3 weeks ago, okay, yeah, exactly, precisely. Yeah, time is kind of blending around here. I have no doubt that given how high the stakes are, when this measure gets back over to the Senate, that they will do the right thing, and that ultimately this bill can get to the president's desk for his signature. So, that's my view. Yes.
Speaker of the House Mike Johnson has made it pretty clear that he has no appetite to bring this to a vote. How does that play into how today's going to transpire?
Well, I would say, one, the good news is that it's not up to Speaker Johnson with respect to this particular measure getting a vote eventually. As Ms. Underwood said so eloquently, it's really only a matter of time at this point. The discharge petition will ripen. It will take 7 legislative days to do so, so you're talking about a vote potentially in early January. And we know that that vote will succeed because the petition has the requisite signatures. So the only real question is Mike Johnson going to allow, as Dr. Ruiz said, families in Louisiana, in Colorado, and across the country to be scrambling over the course of the next 3 weeks as they face these exponentially high premium increases? Or will he do the right thing and simply call the vote now, given the fact that his own members of his own conference have now signed a discharge petition led by the minority party here in the United States Congress? One would think that he would do the latter. And again, if past is prologue, we've seen this movie before. We heard the Speaker for months suggest that he was opposed to the discharge petition regarding the release of the Epstein files, and very much, the Speaker did everything he could to try to stop it. Once that discharge petition had the requisite signatures, a vote was called shortly thereafter. So I would hope that, as I said, Republican leadership would see the writing on the wall, call the vote now. I cannot understand the cruelty of an approach that you're suggesting they might adopt, which is essentially saying, even though we know there are votes to extend these health care tax credits, we're going to send everyone home for Christmas anyways, and we're going to delay this vote until the new year. I just think that is a patently cruel, unconscionable approach. And Mike Johnson, I think, will face electoral consequences, as will his conference, if they make that decision. Other questions? Yes.
Congressman, I want to ask about pharmacy benefit managers. This was brought up a lot in House Rules yesterday, and anybody can answer this.
Sure.
This was brought up frequently in House Rules yesterday. The seemingly bipartisan perception that they're kind of opaque middlemen. They raise prices, reduce reimbursements, especially for independent providers, reduce patient choice. I want to ask, is there a proposal, a plan amongst Democrats to potentially either alter their role or even remove them in entirety?
Dr. Ruiz serves on Energy and Commerce Committee, and they can answer this question.
So if you look at what Republicans and Democrats have passed out of committee, it's been one of more transparency, so that the American people, Congress, and others can identify where these cost savings are going. Are they going to line the pockets of PBMs, individuals, or are they going to cost savings for patients? Once you have transparency, then you can adjust the equations and the formulas so that we can ensure that, in fact, it's the patients that are reaping the biggest benefit from this. Where you go from there is still up for further debate and further legislative actions. In addition to that, we're in this scenario 2 days before we leave, where you have a discharge petition that passed, and you have a lousy bill that's actually going to raise costs and kick 1 million more people off of their health insurance on top of what the big ugly law already did. And during the government shutdown, this same speaker canceled work. It was work that we could have been working on in a bipartisan way to come up with a good bipartisan bill that would lower costs, expand access to health care. But instead, his stubborn insistence of not extending the Affordable Care Act tax credits is skyrocketing costs on top of the already disproportionate increase in premiums that the big ugly law has caused. So this crisis of affordability, this healthcare cost, is of Speaker Johnson and the Republicans making, and their way out, at least to prevent even further skyrocketing, is extending the Affordable Care Act tax credit. And the person that has that authority to make that decision to call on that vote now is Speaker Johnson. It's all on his shoulders.
Questions? All right. Well, I will just simply conclude by saying, so I don't know that we spent a great deal of time talking about all of the ways in which the Republican health care bill, which we'll be voting on later today, would be destructive to the American healthcare system. And Dr. Ruiz and Ms. Underwood noted this, but just to be clear, according to the Congressional Budget Office, if this bill were to become law, 100,000 people in the United States would lose their health insurance.
A million over 10 years.
1 million over 10 years. 100,000 in the first year. Right? This is their health care plan. This is the plan that they've spent apparently the last 15 years devising. They finally put forward an alternative to the Affordable Care Act. This is it. Junk plans and insurance premiums that would increase over time, and hundreds of thousands of Americans that would lose the health care access that they so vitally need. There is a better way. And the better way starts with a vote on this bill that Representative Underwood has proposed, that has now earned bipartisan support in the House of Representatives, and that we know can get to the finish line. We encourage, we implore Speaker Johnson to do the right thing, call the vote. Thank you.
Thanks, Joe.
Subscribe to One India and never miss an update. Download the One India app now.